So this is the camera system which is getting connected to the camera console. And one of the common things which we see breakdown is that the wires from these cameras, where they are entering, they get broken from here, they get loose from here. And just where they are entering the connector, they start getting broken. So one thing which we need to remember, which we need to realize and also make our operating room staff aware of, that everybody is in a habit of pulling this by the cord from here. And this puts extra stress on the connector joint, and this is where they start getting damaged. So make it a habit, make it a practice, and ensure that staff is properly trained. Hold the connector from the connector and not from the wire to pull. Hold it from here and then take it out. So this will ensure that these joints are not frayed and damaged. And now when you are wrapping up the camera, make big loops of the wire so that there is no stress anywhere on the wire, and this will ensure a bigger an increased life of equipment. Don't make small loops where they can get pinched up and get damaged. I will just keep this here. The same thing goes for the fiber optic cable. So this is the fiber optic cable which transmits the light to the endoscope, and this is made up of many fine fiber optic fibers, and if they break, then your light will decrease. So when removing, again ensure and train the staff to make big loops of this fiber optic cable so that it doesn't get damaged. Make it in big loops, and then don't again pull it from here. Just hold the connector from the end and then disconnect. So in this way you will ensure that the life of this cable is also increased, and don't pinch up the cable like this into small loops which will cause breakage of the fiber optic inside. These are some tips to increase the life of this equipment.